Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Ritchie. Hi, Joe.
Hey, Jeff. How you doing?
I'm doing good. How was your weekend?
Oh, we had a really exciting weekend and week, working a little bit with the AO North America and had the chance to sit in a little bit with the trauma course that they do for the orthopedic surgeons and learn a little bit about how they do things, and just very inspiring, which is perfect segue for our interview today with our guest about inspiration, and really excited about today.
That is a great segue. We have a phenomenal episode in store for our listeners and our watchers on YouTube. I'd like to introduce Dr. Mitzi Williams to Dean's Chat. Dr. Williams, welcome.
Thank you guys so much. Nice to be here. Thank you for the invitation.
Not a problem. Thank you for being here. On Dean's Chat, we're fairly informal. Dr. Williams, if it's okay with you, let's go first names, Mitzi and Joe and Jeff.
That sounds great.
Well, thank you again so much, Mitzi, for coming on to chat with our audience a little bit about your experiences. I get lots of questions from current students about podopediatrics and what the opportunities are. And so I'm really excited to get all of your experience and expertise. To do a brief introduction, and we'll kind of do a couple little snippets through your bio as we go through the interview today. Dr. Williams got her undergraduate degree from the University of Arizona in veterinarian science and chemistry. Went on to do her podiatric medical school with Schol College in Illinois, and then her surgical residency with Scripps Mercy in San Diego. I'd love to start with starting out in your undergrad, kind of veterinary science, chemistry. Can you talk a little bit about how you found podiatry and what that journey looked like?
Yeah, no, of course. And again, thank you to you both for having me, and thank you for everyone listening. And many of you are probably in the early starts of your career, and many of you I've met. So again, thank you for listening. And hopefully, again, like Joe mentioned, is hopefully some of this, inspires you, pushes you just a little bit, breaks down a little bit of that fear factor and encourages you to push forward. But at least for the sake of me and where I got started, yes, it was in Tucson, and I loved the University of Arizona. I mean, loved Arizona coming from the East Coast. And I majored in veterinary sciences, and I majored that way because I just loved all the zoonotic diseases and kind of those crazy things per se. And so I really enjoyed medicine. But again, my journey into why do I do what I do now is really an organization that's at University of Arizona. And you guys may be familiar. It's a group called Camp Wildcat. And we chaired cost-free camps for basically disadvantaged youth within the area. And that was a point in time where I was actually allowed to chair camps at the local university medical clinic attached to the University of Arizona. So we were able to do these cost-free camps for children in the hospital, which allowed for me to, work with children in the hospital, design these camps. So I had a lot of kids that had orthopedic injuries, not just cancer or some of the other things that really kind of sparked my interests and pushed me forward. So yes, it was kind of those weird zoonotic diseases, but it was also that interest, I think, for working with kids that kind of pushed me toward that pathway where I think I was destined to go.
So what was it about podiatry that started the transition from undergraduate into podiatry school?
I think it was still kind of those camps in general. I had several kids, and this was very, very early on, not knowing necessarily what I was going to do. I was a track runner. I ran the 400 and the 800, kind of had a plethora of injuries, so was not necessarily naive to certain things. But again, I had several children in the ward designing these camps that had various diagnoses, like hemimelia, so a shortened tibia. So I got to see leg lengthening procedures when I was there, along with some of the things that I tackle now, like clubfoot or just congenital foot deformities. And so many of those children had lengthier stays in the hospital at that point in time, but I got to interact with them and I got to know many of them. And it really kind of sparked my interest toward what I was doing. But at the same time, in residency, my training was really with everything. And so you know this, Joe, but when I started my job was not 100% kids. My job was really 100% anything that walked through the door. Mm-hmm.
Yeah. And, you know, as we've seen lots of different students, and they'll come in with different questions about, or interests, we'll say, in certain areas. And there's a lot of ways that they could fill those roles in their life, a lot of different avenues to be involved in medicine. And so I think it's great that were there podiatrists that were in the camp that you had gotten to see or work with, or what was
You
it?
know, I wish I could tell you that was the case. But more of my interactions were with orthopedists at the time and people that were there. But all of my interactions were great. And all of my interactions, I think, were great because the key with, I think, making an impression is being humble and learning and trying to obtain whatever knowledge you can, right? And I think with that, I mean, you can break down a million different barriers. But no, at the time, primarily orthopedists as compared to DPMs. You know, my relationships with DPMs really didn't even come until much later, you know.
What did some of
Mitzi,
those look like? Sorry, go ahead. I'm totally hogging the interview. Sorry, Jeff.
no, I was going to just ask something earlier. You were on the East Coast, and then you came out to college in Arizona. Then you went back to Chicago for podiatry school, and then back to San Diego for your residency, and now you're in San Francisco. You're a free spirit, huh? I mean, you just go where the opportunities lie.
You know what? Joe will tell you I'm not a free spirit. If anything, I'm very, unfortunately, good and bad, I'm very regimented. I might even have a little bit of like OCD, very, very structured, but I think that works in my favor. But the one thing I have absolutely never compromised, and again, not everybody has different barriers or different constraints. But for me, I never necessarily was tied down to one geographic location, you know, and again, some people have families, some people have reasons as to why this is not the case. But for me, it was a matter of where was the best fit, where was the best education, and where did I really think that I was going to thrive from a knowledge standpoint and from a relationship standpoint, right? And for me, I found that that was very important. And I also think that that has helped develop a sense of independence. And I think it's helped to, you know, develop a sense of feeling like still in this career that it's okay to make change, right? And not necessarily be bound down by one area, although life gets hard. And sometimes those geographical constraints are very real.
I brought that up, Joe, because I think it's interesting, especially right now as our students are picking clerkships all around the country. Joe and I are mentoring our students and kind of encouraging them to go to certain areas for different strengths that our profession has to offer geographically, but we don't want them to think geographically early in their career because that's not necessarily where all the opportunities lie.
That's right. That's right.
Sorry, Joe, I cut you off before.
No, this is all excellent. So as we continue following the career of Dr. Williams, with your residency program, you did have a unique opportunity to go to Iowa as well, as we talk about moving all over and taking opportunities as they present themselves. But we also love to highlight mentors, and you had the unique opportunity to work with Dr. Ignacio Poncetti in Iowa. Do you mind talking a little bit about what that experience was like and maybe how it impacted you?
Oh, and I think many of you, I may have spoken to several students, even at our previous ACFAS meeting, about this experience. And it's still crazy as to how it happened. But I think just one step before this, you know, Dr. Donald Green, who was my residency director, you know, again, we talk about relationships, and I cannot tell you how much of an integral role he has played in my career. Still to this day, he critiques my presentations. He critiques the way I deliver things. He's a true teacher. And so without him, I don't believe I would have gotten to Dr. Poncetti. And the reason for that being, I had gone to a POSNA meeting, so a Pediatric Orthopedic Society Association meeting, when I was a resident. And I had gone on my own time, and it was in San Diego, so it was very easy to maneuver. And I went to this meeting, and I was going to run into the restroom. And this is how really all good stories start, you know, by the restroom or the bathroom. And so here comes out of the restroom Dr. Poncetti. And I'm looking at him like this because his badge is upside down and all distorted, right? But I'm going like this, and I'm like, I think it's him. Like, I really think that's him. And so I got very, very close to him, and my face is still going like this, right? And literally, I said, "Oh, Dr. Ponsetti, you don't know me. I'm Mitzi Williams." And I said, "I'm just a resident here." And I said, "But I'm a podiatry resident in San Diego with Dr. Green." And I said, "I would love to come to Iowa to learn." I was like, if anything works for you, I'm happy to come. And I kept saying, "But I'm in podiatry, but I'm in podiatry," right? And he looked at me and he said, "What did you say your name is?" And I said, "Mitzi." He said, "No, no, what's your last name?" And I said, "Williams." And he goes, "Where are you from?" And I said, "Well, I'm doing my residency in San Diego." He said, "No, no, where is your family?" And I said, "My family is in Charlotte, North Carolina." And they said, "Oh, what a great place." And he goes, "Mitzi, I don't care what your degree is." He goes, "If you want to come and learn from me, I want to teach you." And I will never forget that, because that was that moment or that relationship where it was one of those, you can kind of feel your heart pounding, but you're like, am I going to embarrass myself? There are all these different people around me, right? But it was like that moment where you're just like, no, no, let me just do it. I have to do it, right? And everything just kind of took over from there. And that was the moment where I look back and I'm like, gosh, if I had not done that, that wouldn't have happened for me. Because I am certain if I had sent an email, that interaction would not have, the interaction was more meaningful than me sending a generic email off, which I'm sure he got millions. So I went back to Dr. Green, who, again, I cannot say enough wonderful things about. He has to watch this at some point, I hope, so he can hear me talk about how wonderful he is. But he looked at me and he said, "Huh." He's like, "So you met who?" And I said, "I met Dr. Ponsetti." And he says, "I guess I'm going to have to let you go out there then." So he let me leave my residency for a period of time to go out there, which was fantastic, because the first time I ever went out there, I met the leading clubfoot expert now in Russia. He trained with me, and he is fantastic, and I have a great relationship with him. I also met another pediatric orthopedic surgeon from the Philippines who was practicing, and she was being trained at the same time as me. And so it honestly was a very, very integral moment, but a very, very powerful relationship, that sparked from that. And then likewise with that relationship, it's never just you go for 2 weeks and you get everything, right? And that's always the key that I tell students when they come out to visit me is, I will teach you as much as I can within 2 weeks, but I don't expect for you to be able to tackle the very complex kids, right? You're not going to be able to do everything with your hands after being with me for 2 weeks. That happens over a very long period of time. And so I kept going back, and I kept going back until he passed away, which was very hard. And it was very hard for many people, and it was very hard for many families. But the one thing he told me when I was there is he gave me 2 books. He gave me that little green book, which is his book, which everybody always looks for now. And he, wrote it, signed it for me. And he also signed one for Dr. Green. So I was able to give it to him. His wife wrote another book. She signed hers and said, "This book is better." So there was always this little competition, which I can completely value. But he also gave me Dr. Kite's book. And for students who know that name, Kite was the surgeon who was not necessarily wrong in his thinking. He just had his thumb just a little bit too far proximal or distal. And so he gave me that book because he said, in order to know how to do something right, you have to know where people were when they were doing things not so right, right? I don't want to use the word wrong. But that was also very powerful for me. And as a surgeon, I think that that's something I hold on to, because we continue to learn more from the things we get wrong, per se, or the things that don't go as well as compared to everything that, is predictable and goes well. So that really was my moment to kind of hopefully instill some sense of inspiration to students, and, having the courage to speak up, and continue to learn and be knowledgeable, but very much so be proud of where you are in your career, and be very, very proud of your degree, because your knowledge is really second to none.
What are your
I just
thoughts,
love
Jeff?
that. Oh, I just love all of that. I mean, there's so many lessons there. Mitzi, I totally agree with you about the evolution. If you go back in surgery books, or if you go back to diabetic foot books, everybody was doing the best they could at the time they wrote that book with the most knowledge possible. But the one thing that is universal is that relationship building. And it's so incredible. I had a similar experience with Dr. Paul Brand. I called him cold turkey on the phone, and he took my phone call for a half hour. He was a diabetic foot, Hansen's disease specialist. But I had that same experience. And I'm not even sure what that jumping point is, or as you mentioned earlier in another podcast, that Geronimo moment, Joe, where you say, oh, I'm going to go for it. This is my chance, right? I just think that's such a phenomenal story, and what a cool opportunity to have Dr. Poncetti as one of your mentors.
Yeah.
And I think it's really a beautiful illustration too of that vulnerability moment. Like, what's the worst thing that could have happened? He could have just been like, hi, nice to meet you, and he walked off, right?
No.
All right.
No.
It'd be very unlikely that he would like yell in your face or do anything really destructive. So just having the courage in that moment to just introduce yourself and say thank you. Like, I know of your work. Thank you for everything you contributed. And then why not? Could I come out and just be a fly on the wall and just learn, have the opportunity to learn from you? And look at what that did in terms of the impact on your life and the impact on all the lives that you have been able to then also go on, that rippling effect that happens.
Right. That's right. I think, you know, that's a true teacher, right? You know, a true teacher is one that there is no ego there, right? Basically what they want is people to continue to do well, right? They want people to be proud of. And for me, I feel exactly the same way. You know, I answer emails and messages from all over the world, and I will look at photos from all over the world. And the goal is, yes, to help the child, but the other goal here is to elevate people who are motivated to do the work. And I think that is a teacher, you know?
That's interesting, because so many people have the ability, but don't have the opportunity to take advantage of those learning opportunities. And we've talked a lot about reaching out, additional education, whether it's formal fellowship or not. I think so many people that we've interviewed, leaders in the profession, have taken advantage of the generosity of the teachers to share their knowledge and their experience. And I think that's a common thread we see with leaders in our profession, Joe.
Yeah, absolutely. And so to kind of piggyback on that, if we can rewind just a little bit. So you got to go and study with Dr. Poncetti, completed your residency program. And then if I'm not mistaken, I think from residency, you were hired with Kaiser Oakland. Is that correct?
That's right.
So can you talk a little bit about what that journey, when you had started there, you were not doing pediatrics, and then how did that kind of become part of your practice?
Right. And honestly, it's very comical when I look back as to how that job transpired, because it was the same kind of thing. I had interviews all over the US, and there was one position in California I was very much so looking forward to. And I was sitting on the floor of the airport because there was no seat. I was sitting on the floor of an airport, and I had realized that the funding fell through for a position that I was very hopeful I would get. And as I was sitting on the floor of that airport, I got a call from Dr. Benning, who has since passed, unfortunately. And he said, we have an opening at Kaiser Oakland. Would you be interested to come out to interview? And I said, when should I come? And he said, well, when can you come? And I said, well, I'm about to get on a plane, but I can be there first thing in the morning. He said, that sounds great. Come first thing in the morning tomorrow. And so I remember I ended up there and developed also very, very good working relationships with him and Lawrence Ford and eventually Christy King, who was your year, and everyone else there, Jason Pollard. And that kept me there for a very, very long time. But when I started there, again, I was trained to do everything. And I felt that it was important to come out and do everything. And the reason for that being too, if you don't come out and do all of these things that you're trained to do, and you give yourself time, you're not going to do them, right? So, you know, with volume comes less nervousness and the ability to perform. And that's key with anything you do. And so I did it all. And gradually pediatrics kind of came in, and that number continued to grow. And that number continued to grow. That number continued to grow to the point where most of my time was spent doing that, except for the time where I would have to take call. But when I came out, no, you saw me, I think, when you were a resident, Joe, my practice was very much so not what it is today. But I do think that that's important when people come out of residency, is do it all and figure out, number one, what is it that you want to do? What is most motivating for you to do, and do a lot of it, right? But the hard piece about this is if you don't come out doing a lot of various things, people develop, I think, a nervousness or a hesitancy, and they don't do it. And then they're a little bit more shy, or they don't do certain things. And so I think coming out, there's a little bit of a balance with that.
So when you first started, I know certainly when I was a resident, you're right, we did not, our pediatric exposure was primarily actually through Walnut Creek with Steve Silvani and Dr. Colburn when he had been there, who were the Poncetti kind of referral centers. I remember you had worked a little bit with Dr. Phil Warganowitz, which I think he was actually ortho-oncology,
Yeah.
not peds,
Yeah.
but he obviously did a lot of peds
Right.
in that.
Right.
Was that how you kind of started to develop that kind of relationship? And then I know Scott Kaiser came in. How did that kind of play out?
You know what, I think what ended up happening is Phil and I had a very good working relationship in orthopedics, as well as me with the other pediatric orthopedists. And I think what ends up happening is you treat one baby, but just talking about a diagnosis of clubfoot. When you treat one child, there is an incredible network of social media when it comes down to clubfoot. And I think that went crazy. So I think that social media was one piece of that. I think the other piece of that was, yes, you had people within a very large health plan that retired and left. And then you also had me being at a pediatric center, which has pediatric neurosurgery on top of pediatric anesthesia. And so we were equipped to do all of these things. And so not only was it social media and some of the more isolated clubfoot conditions that didn't have a secondary diagnosis, but it also then became a great deal of spina bifida and a great deal of arthrogryposis and a great deal of CP and or spasticity. And that grew incredibly. And again, I think it was the growth being at the pediatric center, social media, but also I enjoyed doing it. And so I never said no. I never said no to a family that needed to come in, never said no to another opinion. And then that also morphed into patients coming to see me that were not even Kaiser members, right? So no longer could I handle that volume on top of everything else.
What are your thoughts, Jeff?
I'm thinking of the confidence competence equation. And then you kind of mentioned it before when you're talking about you can't go somewhere for 2 weeks and become good at something or have the confidence to treat it. What was that curve like for you? Obviously you've been doing it for a long time, and the more you saw, the better you got, and you had good mentors. But that's so important for our students also. Confidence and competence at any level, any stage of your learning plays a part in your ability to deliver and take care of patients. Because if the patients see that you're unsure, they can see it, right?
Well, that's right. Well, that's right. And that's where I think the most helpful thing for me has always been volume, right? So, and it's the same thing for any surgical procedure, is you're going to learn from your volume. And so the key is not having one or two. The key is, listen, this is your day, right? And that has really helped me. The other piece that's actually really helped me personally, and I'm not saying that this is good for every single person, but it's recognizing what availability looks like. So for me, availability means to answer parents and families very quickly. Number one, it's for them. And number two, it's for me, right? Because I like to make sure nothing's wrong, right? So I like it when families send me photos if they're concerned, right? I like, parents reaching out to me and me making sure, no, we don't need to do something, or I need to bring someone in. And so that availability piece has been also very important. But again, it's very hard because when you develop a niche for something, you don't have as much backup to cover you, right? And so part of my world is I don't necessarily have someone to cover all of these things when I go to a meeting or when I go here overseas, right? So you learn also how to navigate those things when you can't necessarily be right there geographically as well. So that has helped me tremendously. But the volume is key. If you do one or two, you're never going to get to a point where you feel comfortable troubleshooting the things that need to be troubleshot.
Well said. And all the nuances to every case, you're not aware of them unless you've seen it a lot.
That's right.
So I'd love to shift a little bit, not too far, to some of the other creative outlets. You had talked a little bit about social media is a way that certainly, and actually just to put this in for the historical perspective, which I always think is so fascinating, Dr. Ponsetti had been doing his work for 40 years, maybe, before it actually took, it may be even longer than that. I don't remember exactly, but you may know the exact date, but his work really took off in the early 2000s, and it was because of the internet. Parents were desperate for options to treat their children with clubfoot. And finally, they were getting information about Iowa City. There was a doctor that was doing something that wasn't these really pretty dramatic surgeries. And that was the thing that took off. But again, years of him doing the exact same work and publishing and trying to get the word out, and it just never took off. And now we have the internet and people are able to find information. Good information can be challenging. Mm-hmm. Tell us a little bit about the children's books that you've written and what the kind of inspiration behind that was.
Mm-hmm. Well, the piece that I realized anytime you treat children is, yes, my patient is the child, right? And the one I interact with the most, and the one I communicate with the most, and the one I make eye contact the most is that young person that I'm treating, right? But you have numerous different family structures, right? And when you treat a child, you have to be able to figure out how to communicate with all of those different structures that exist, right? Which is an art. And some are more challenging than others, right? But the books came about because I realized that I could say all of this stuff, and I would think, gosh, I am so good at saying all these things to kids, and I'm so good at how I speak to parents. And then I would see them again and realize they didn't understand not even 20% of what I said, right? And I get that piece, right? You bring your infant in, say it's a newborn, and you're bringing them in for me to cast. They're focused on their baby, right? They're focused on when their baby cries. They're focused on what's going to happen to my child. They've even got in their mind, gosh, is my baby going to walk? They have all of these things in their head that when I start talking about what it is we're actually going to do, they're not necessarily retaining all of that. And so, those books have been very, very helpful to explain different conditions and empower children using children's own language that I have gotten throughout the years. But at the same time, I encourage parents to read those books at night when they're trying to put their child to sleep. And the reason I encourage them to do that is because it's basically reiterating all of the things I stay within a visit and all the things that I think are important that I want them to hold on to. And at the very end of those books, we have fun facts, which basically it tells the truth, right? So there's so many different scary sites that families can go to, but this basically gives them the facts, whether it's clubfoot or vertical talus or spina bifida, or my fun feet, which basically has, a million different foot conditions. And so I have found that to be very empowering for a child, which I love. We recently just had a little one with spina bifida it was her About Me week. And she went in and she read that book to her class. And there was nothing better that was going to happen to me that day when that girl came in, and she was so proud that she got to read that book and talk about spina bifida. And I hear about this all over the world. And so I think those books have, helped children. They've helped families. They've helped schools. You know, it's from an inclusion standpoint, I think it's helped. But I've seen that be very, very helpful, you know, with a bunch of different conditions, and numerous different ages.
That is so incredible.
Mhm.
Mitzi, I have a technical question for you
Yeah.
about that. So you were writing the content,
Mhm.
and you know, you could have just done an FAQ PDF, right? But you turned it into a book, so it's fun
Mhm.
for the kids and the family. How'd you do that? I mean, did you find yourself a publisher, and who was the artist, or did you write
Oh,
do
I
the
messed up.
drawings?
I messed up so many times on that first book. I even, you know what? I didn't even realize the spine of a book. I think my last name was spelled wrong on the very first time it went out. And one of my very, very good friends, Matt Cobb, says, "Hey, I love the book, but I think your name's spelled wrong." And I was like, "Oh my gosh," you know. So um, that was a very big learning curve. But like I said, it's one of those things you do it once, you know, and we've been able to create, you know, five books, I believe, since. And so you do it once, and every single next time it gets easier and easier, you know. Um, but the process is enjoyable. I can tell you that. That does not feel like work.
That's incredible.
Mhm.
Joe, we'll have to put all in the show notes where parents can get these books. And you've got do you have a website, Mitzi?
I have a website people can go to.
Great.
It's drmitzywilliams.com.
That is
Yeah.
so cool.
Yeah.
You
Again,
know,
just that social media, having the opportunity for people to find you and connect with you, and both patients and families, as well as residents, students, or even mid-level provider, mid-career
Right.
docs that are considering, they maybe love pediatrics and they've been doing a lot of it and they're wanting to grow.
Mhm.
And maybe that's a great segue.
Yeah.
If you were to give advice to someone that is wanting to maybe take on a little more pediatric, and again, these are not and not to downplay sports injuries or any of the other typical things that we see for pediatrics, but these are usually fairly significant diagnoses that families are managing, not just foot and ankle related. What would be your advice to someone in terms of how best to start figuring out how to map that mentorship process?
Mhm. Well, there are not many fellowships in this world when it comes specifically to pediatrics, although there is one in New Jersey. But outside of that, you know, I think for somebody who's practicing already, you know, you have to take into account where are you practicing, right? Or what state are you practicing in, and who's in that area, right? And when you look at that area, well, if you can align yourself or become friends and colleagues with people who are either working at a children's hospital or doing a lot of that work, well, then that's one avenue. The other thing we have, again, you know, I very much so pride myself on, no matter where I am, is teaching, and not just the US, but internationally. And so we have plenty of people who we can easily welcome wherever I am. And they can even come internationally to stay for a period of time to learn. But like I said, you know, when you come to learn and see things, you do obtain a good portion of knowledge, but there's nothing that you're going to learn from more than when you have to do it with your own hands, right? And I always tell people the same thing. There's only so much you're going to get from casting a model as compared to casting a baby. And what size baby are you dealing with? What age of the child are you dealing with, right? There are a lot of different things you have to take into account. But again, people can approach me wherever I am. And again, it's very easy to have people come to stay and visit with us. And one of my colleagues who is, I hate to say this, but yes, is the international lead for some of these things. I don't like to give him too much credit. Matthew Dobbs is also very welcoming and is essentially what I like to say is, you know, Dr. Ponsetti, one of his greatest fellows and students, and also the father of vertical talus. And so again, very equipped to take people on who really want to learn and are motivated to do more.
Joe, I was thinking we could talk about some of American College of Foot and Ankle Surgeon work, giving back to the profession. As if you don't have enough on your plate, Mitzi. I know you're doing lots of things for the profession, and it's always that takes time out of people's personal life too, and it just shows the dedication that you have. But can you talk about some of the work you've done with the American College of Foot and Ankle Surgeons?
So yes, I do sit on the board for the American College of Foot and Ankle Surgeons, and it's a fantastic board. And I think we all are very much so forward thinkers. And I like this part of my career right now is not just working, but thinking about where do I see the profession going, and what do I think the next steps for our degree and our profession are. And that's exactly where I want to be. And so that's been very much so, I think, my impetus for being on the board at this point in my career. But some of the very best things I think we've done, I think, is our collaboration, I think, with various degrees, especially with our scientific conferences that we've developed. We have developed this leadership aspect, and then we're elevating more and more speakers, elevating more and more into the virtual realm. And so, I like that. I like to see more people become empowered and leaders, but at the same time, the whole forward thinking is very important to me. And sometimes that's a hard thing to do, right? It's very easy to keep doing the same thing, but when you think about where do you want to see the profession in the next 10 years, sometimes that's a little bit more challenging. But that is exactly why I wanted to be on the board now.
So you're hitting on a bunch of hot buttons right now, Mitzi, because we're dealing with the same thing. Obviously, when you're with the college, or I work with the AACPM, which are all the colleges and the residencies. Our profession is at a little bit of a tipping point right now. We've done such a good job in advancing medically, scientifically, surgically, but we're challenged a little bit on the student recruitment front. And I'd be interested in your thoughts on what our profession is going to look like 5 to 10 years from now. Because we are facing some challenges right now.
Yeah, the student recruitment is it is a good topic. I don't want to come across like I have an answer. I don't have an absolute answer, but I see this within my own children. I have a 9-year-old and I have a 5-year-old, and the things I realize is there's got to be some sense of a motivation or a spark that happens early, right? And that is one thing I have realized is, just like I said, Dr. Ponseti inspired me. It's a question of how do you inspire people, but at an earlier point, I think, within their life that makes them want to take a certain pathway, right? Now, I don't have the answers as to how we go about doing all of that just yet, but I think that if we are only tackling people in college, might actually be a little bit too late, right? But if we are, putting our time and efforts into much earlier or younger individuals and really sparking that interest and developing relationships, because I think that is how you truly motivate people and want, inspire people to do more. Well, that probably is going to be more helpful too. The other part of this is, student recruitment, that's great. But I don't want to just recruit a student. I want somebody who is motivated, who I can look at and be proud of, and who I think represents our profession well. And so when you think about how do you recruit for that individual, well, that's a more perplexing topic, right? But that's what we need to look at. Is the person who wants this field as compared to the person who maybe wanted all these other things and maybe things didn't work out. But I think things have to happen much younger.
I agree. And maybe that's why we see so many legacy students coming through that know what they're getting into because they've lived it their whole life.
I mean, that's exactly right. That's exactly right. My son will never go into medicine. I have failed. I'm not sure which one. My daughter, though, there's a chance. My daughter has actually casted models with me. She knows where you're supposed to put your fingers when you're casting for clubfoot. when I leave for Poland or Abu Dhabi, she helps pack the luggage, although it's filled with stuffies for the kids, which I cannot bring. My daughter, there might be a chance, but this is what I'm talking about, is when young people can see, right? They see somebody who likes their career and truly enjoys it, right? There's a feeling that comes from that. And I think however we generate that feeling in student recruitment, it will be helpful. But I don't have all the answers for that.
I love your perspective, Joe. I'd love your opinion too. This is leading towards branding and awareness of what we do at such a younger level. I mean, to the point where you could even be doing screenings at schools. Why are your feet important? And get to the point where down the road, when we go to a college and we're talking about the Arizona College of Podiatric Medicine, we don't have to define podiatry, then recruit them. They'll already know what it is.
It's too late. At that point, I think it's too late, you know?
Yep. I'm with you. Joe, your thoughts on that?
Yeah, I think there are so many levels, as we've talked, Jeff, in the past. Once you start to peel back the onion, you realize how complicated it actually gets, and that there isn't a one size fits all answer. There isn't a simple path to fix the problem. But I think the overarching low hanging fruit is the branding issue. Like, we have a hard time defining I mean, everyone will say something similar, but there isn't consistency in what podiatry is or what foot and ankle surgery is. And again, not to, I don't want to take a whole bunch of the time for this particular interview to dive into that, but it is pretty complicated. And I do think we're moving in the right direction as a profession to delineate what those things are. But I think that's going to be probably one of the largest challenges, is trying to get this profession collectively to maybe even agree on what that actually means, because there are and I think the silver lining there is there are so many opportunities within a specialty that it's hard to just put one blanket brand on us, because there are so many different ways that you could practice as a podiatrist. But I think I might just stop my ranting on that for now, because since we do have a little bit of time, what I would love to get Dr. Williams's experience and take on, maybe as like our wrap up. You had mentioned some of the international work that you have done, and again, as another topic that I know so many people are interested in, is the idea of medical mission work. But maybe we've had others that have talked a little bit just kind of generally about medical mission work, but possibly even a little bit with the organizations that you work with, because some of the things that we want to be careful about with medical tourism is going somewhere, doing a bunch of things, and then leaving. And you had talked about, some of the hard thing is you don't have coverage, since it's sometimes a niche. And so I would imagine some of the logistical challenges with something like international medical mission work with pediatrics too, is having that network set up in these different places. Can you talk a little bit about your international experience?
No, sure. So my international work has been nothing short of amazing. Number one, I love my work in the US, but being able to branch out and experience other cultures, and especially working with young women in other countries, has been nothing short of incredible for me. The pediatric orthopedic surgeons, pedi neurosurgeons, physical therapists, I learn an incredible amount from them. And I've learned a lot, which I can easily take back to the States. One point to clarify, what I do is not a mission trip. There are definitely different infrastructures around those types of trips and reasons as to why you might do certain procedures. But when I have gone overseas, a lot of that has also been for my own educational benefit too. But I go over with the Paley Institute, and there is an institute, there's a Paley European Institute, which is in Warsaw, Poland. And there's a second in Abu Dhabi, so Paley Middle East. And these are very structured institutes that are present, that have local pediatric orthopedic surgeons that work at both institutes. We have an incredible physical therapy team at both. We have surgeons that tackle everything from head to toe. And so again, these are very, very equipped institutes that are present. And if we are over there assisting or doing various procedures, we still maintain all of that follow-up, or those orthopedic surgeons may see them for those follow-ups. We have great orthotists who design braces. Again, you know, anytime you get into the world of pediatric orthopedics, the surgery is only one fraction of what happens. The physical therapy is key. The bracing component is key. Medical management is key, especially if there are underlying conditions or things going on. And so this has been incredible from a relationship building, from an academic, you know, standpoint. It's allowed me to continue to learn more, going over with those group of surgeons as well, who I really believe are on the forefront of numerous orthopedic conditions. But we have a lot of care, the bottom line, when we go over there. But it has helped me navigate my practice, you know, when I'm overseas, and how am I handling things, and when do I schedule my own post-ops, you know, and I can't stress enough having a structured protocol for procedures you do. If you have a structured protocol for procedures you do, then no matter where you work, your team can follow those structured protocols, right? And you don't have to be guessing as to what needs to be done. So that too has been very helpful, I think, from an international standpoint.
Protocols almost seem like consensus documents,
I know.
or checklists if you're a Tool Gawande
Yeah.
or something. Wow, this is phenomenal. Mitzi, thank you for such a wonderful discussion. Joe, any last comments?
No, thank you so much. Again, it's such a pleasure to get to kind of connect and really just dive into all your different experiences and a very unique part of the field that not many people have the opportunity to talk about. So I really appreciate your time.
No, thank you guys. Thank you both.
Oh, thank you. What an incredible discussion on a lot of different topics. And Mitzi, I can't imagine how many families you've impacted in such a positive way. And that's incredible. It's really a testimony to your resilience and your training and your, you know, that emotional intelligence that's required for treating kids is incredible. So kudos to you.
Oh, I honestly really love it. I love what I do. So it makes it very easy for me.
Oh, that's a good point. Good
Yeah.
point. Well, to all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating. And if you can, make a couple comments. And if you're watching on YouTube, we'd love for you to become a subscriber. Mitzi, we're going to send you one of these Dean's Chat cups.
Oh,
nope,
nice.
we got them. And you can enjoy your beverage of choice with the cup. And until next week, everybody, cheers.